I ask apologies because I have my teleprompter, but I want to be clear. Let me ask a question. Is there a definitive treatment in dentistry? The answer is obvious, it's there. No, there is only longer or lesser duration. If this answer is clear for us, we can transmit the same message to the patients, to the students, or general people. Why we forget the long term of the restorations? Why the patients think the restorations are forever? For example, the prevention is continuous. It's not definitive. Today, I will talk about two other treatments, but any one is definitive. It's important to recognize that dozens of articles are published every year, and it's impossible to be aware of all of them in order to perform a clinical work. We must not be close to other possibilities than shown sources, but that are either too young or too old. We have other methods, for example, medicine based on non-scientific method. It's not false, but it's uncertain. We could say that the clinician is the least important within the investigative hierarchy, even though make up the majority of results based for the studies, and the studies are beneficial for clinicians. I want to speak about the stainless steel crowns. Haven't thought they are the restoration that more supports evidence. I love the stainless steel crowns. If you search one article over stainless steel crowns, maybe you can find 60 or 70 articles that support it. That is evidence-based. Today, I will talk about two other types or alternatives of treatments. Sometimes the resources are available are sometimes a limiting factor. But at the end, strengthen our criteria when I'm making decisions. Today, I will lead my lecture as what I am, a clinician to clinicians. When I go to some congress or scientific meeting, 95, 98% of the audience are clinicians. Only a minority conduct research in my country. It's sad, scientifically speaking, but it's a reality. The references are cited in the slide for review. The consistency are consolidated with the cases that will be presented. The simple question that distinguishes from the general consultation is regarding behavioral management. What is the main objective? It's not create a world of illusion and fantasy. And curiously, it's not have an excellent behavior in the patient. That is a consequence. The main objective, according to Wright and Kupetsky, is to establish bilateral communications. Sometimes, in some patients, it's difficult because the patient is a baby or have special needs. But the parents cover this wall. Some treatments are successful at the end. A pediatric patient who is referred with another specialist need a previous ambience, so they have a good behavior during the treatment. A child in mixed dentition has other interests, which can potentially make them friendly or completely the opposite. In Mexico, all the patients can be potentially friendly. But near to Mexico, in USA, all the patients can be potentially enemies in lawsuits. The topics must be based on their personality. So they don't feel uncomfortable. They must understand that we are close, that they are friendly, but not close. They need this line to respect.